You want us to go to the modes of transmission?
Yes, please.
Now, firstly, I've talked about the issue of this particular organism, being absorbed by individuals. Some are even, carriers. Carriers are those who have, who the organism infects them, but they don't show any manifestation.
How did those carriers get it in the first place?
The carriers get it because I said they are normal commensals. In the throats, in nose, they are normal commensals. They don't harm.
So it's normal to find it in individuals.
Okay. So, but those are the ones that we call carriers. But when the immune system of this carrier gets depressed or is low, then they are susceptible to it. And they can also pass the infection to other people without them getting sick. So that is one aspect of it. The other aspect that we need to look at is that it can be transferred from one person to another. It's a direct transmission, person to person transmission through respiratory droplet, through secretion from this particular person, from any part of the mucosa, from the mouth, from the nose. If there is close or prolonged contact with individuals who have this disease, there is possibility of that particular individual having that particular disease. So those are, the risk factors that you look at. Aside that, I've mentioned other risk factors, which are individual, which has to do with age, because at that time the immunity level is not as high as that of the adult. We have talked about the level of nutrition. That is another factor. Then you look at the population factor, because it easily spread where you have overcrowding. We have ventilation, we don't have cross ventilation. And aside that too, you have it in the population where you have upper respiratory tract infection can easily be spread from one person to the other. Then environmental too, dust. In areas where you have dust during the dry season, it's easy for the droplet to travel fast. So those are factors that affect the spread or the transmission of this disease. So issue of sneezing, kissing, when you have direct contact with the secretion from somebody who is infected, when you kiss, then you are exposed to it. So there is possibility of that person being infected and coming down with the disease and then transmission. So that also means that healthcare workers who manage such patients or who are seeing patients with such symptoms,
because they are in close contact,
high index of suspicion, and should ensure that they observe the universal safety precaution when attending to these patients.
Okay, now let's look at the signs, the symptoms. Somebody who has come down with meningitis, or are there signs that could precede that time?
Well, for meningitis, the first one is the high-grade fever. Fever comes first, and then we can start plus or minus look at other ones, especially neck stiffness. And there can be altered consciousness.
Neck stiffness seems to be a very, typical one, classic.
Neck stiffness, fever, headache, you have vomiting, you can have loss of consciousness, and if the case is not treated early, if the treatment is delayed, then it can lead to death.
Because some of these symptoms you mentioned could also pass for some other illnesses.
It could pass, but
the classic one would be that
the neck stiffness is classic, and there are some other signs of which we call signs of meningeal irritation that will be elicited by the physician. But when you have fever, you have neck stiffness in any patient, especially at this point in time that we have epidemics of cerebrospinal meningitis, that health worker should have high index of suspicion to say that I am suspecting meningitis until proven otherwise.
Somebody may be watching and saying, I sat by someone yesterday who was coughing or sneezing, I hope I've not,
Well, it's possible. I've had a call while trying to come into the studio of somebody who called of the sister in Lagos who have neck pain and fever and something. It's good because you have a net, a drag net to catch so that you don't miss any. and then you can rule out. It means that the enlightenment is ongoing. People are aware, people are well informed. Even what we are doing now, we are creating public awareness.
So if, for instance, I sat by someone who coughed or sneezed, on me yesterday, what is the incubation period so that I may start counting and say?
Well, an average of 4 days and the range of 2 to 10 days. And it is very, because aside that, when even a patient presents in the hospital, so now Lagos is not having any case of cerebrospinal meningitis. And when you have a patient presenting with fever, with neck stiffness, then you now have to ask any history of travel to any. You may say no, but again you look at where are they living? Are they living close to where you have people who come from those parts of the country?
Okay, so we want to look at where the person has been, and yes, we talked about some of the states that seem to be the epicenter for this, but we've had, from information saying some other states, like Lagos, somebody mentioned, it was mentioned in Lagos, but I've heard the commissioner say several times that we don't have any confirmed case of no confirmed case, but something close to it.
We don't have. I told you that when you look at meningitis as a whole, you have those that easily cause epidemic, and that is the Neisseria meningitidis. About 80 to 95% of epidemic caused by meningitis come from there. The other forms of bacteria are normal, and they are not the epidemic prone type of meningitis. So in Lagos we don't have both this case, and we don't have any death also from meningitis.
Okay, but you are not resting on your horse.
No, in Lagos we are always on our toes.
Okay, let's just take this break. When we come back, we'll be talking more about how to prevent meningitis, and you have the time to call in for questions or comments. The number to call is 0808 054 2232. Just stay with us on Health Matters.